Wagoner Community Hospital in Oklahoma has been working to reduce their total patient harm rate.
I'm Brandy Moore, and I'm the RN Infection Preventionist and Case Manager at Wagoner Community Hospital. I think the thing that we are probably most proud of is our outcomes. Just looking at our harm across the board, we have been able to sustain a 0% CAUTI rate for the past 2 years. We also have hit a benchmark goal recently, which was to reduce our patient readmissions rate by 20%. And that's something that we've had to work on consistently, but again, with the tools that we've learned in consistent participation, we finally hit that benchmark goal. And then again, just the focus on continuous quality improvement. That was not something before we started participating that we looked at continuously. We started a subcommittee for clinical patient safety. That again allows us to pull all of our department heads together. We look at patient safety from that clinical perspective rather than just the big umbrella of safety. It puts all of our department heads together, and they really have the kind of the deeper knowledge of the different trials and tribulations that our core front staff go through, and they're there to kind of share that information, and then we can develop our strategies from that point on. I think the biggest thing for us is looking at that composite rate, kind of put all of our data on one playing field, and what that taught us to do was to think up instead of think down. With quality patient safety, and when you're making changes, a lot of times you think down towards your downline staff, giving them the tools that they need and helping them implement the change, when we really should have been thinking up to our leaders. The great thing about the HAB storyboard is it places all of that information, which is scads and scads of information, in one small spot. And it's very visually enticing, and it gives us a part where we can take that to our hospital leadership, because at the end of the day, they're the one that drives the change for us, and they're the ones that give us the focus to drive our patient safety. So without their participation, it's hard to get those things done. But to put everything on one spot, that allows them to drive the change from there. And that really is an opportunity for growth. Taking the data from all the different elements and placing those things in, that's a lot of information, it's a lot of numbers, but it's not real until it comes out on that HAB storyboard. When it comes out on that HAB storyboard, and whoever you're presenting to can see those spikes, and they can see in those categories the fluid changes, because as you do it monthly, sometimes you're doing well in one category, and then all of a sudden you have something go south or change, and it just allows us to really give that in real time to our staff. We can report it quickly, and then they can kind of reflect back and tag with us what happened along that patient line. So it makes the data more real.